So what should you do? What should you check, and in which order when you come across an accident or a casualty? When you come across a casualty, you need to check for Dr. ABC. You need to check for any danger. You need to check if it's safe for you to go and help, or will I get hurt myself? The next thing you need to check is the response of the casualty. Do the casualty respond to me when I speak to him or when I touch him on his shoulder? If not, then he needs medical help. So you need to call for medical help. The next thing you need to check is the airway of the casualty. Is the casualty airway is open? Sometimes his tongue may obstruct his airway, or may the casualty be in unrecovery position. So you need to try to open airway, to check his airway, by trying to open his mouth and trying to tilt his head upwards and backwards, and to raise his chin upwards and tilt his head backwards. So you can open the airway here. This way you can open a way here in his mouth to go through his trachea and to the respiratory system. Here his tongue, or he may be has a blocked airway here, so you try to open a way. And you can also put the casualty in the recovery position if there's a kind of blood in his mouth or something. So this recovery position will let his mouth clear, keep his mouth clear of anything from of any material, and will keep him breathing normally. So the next thing you need to check is breathing. You need to check if the casualty is breathing normally or not by trying to get closer to the casualty and try to look with your eyes at the chest movements of the casualty. Does his chest move normally or not? And also this position will let you hear his breathing from his mouth, so you can hear if the casualty is breathing or not. And you can also feel his breathing on your cheek. So try to check the breathing of the casualty for 10 seconds at least. Okay? Try to check if his chest is rising and falling. Listen to or feel. Listen and feel his mouth breathing for at least 10 seconds. Next thing you need to check is the circulation. You need to check if the casualty circulation is good or not, because his heart might stop and his heart stop pumping blood to his blood vessels. So you can check his pulse. You can check his circulation by checking his pulse, radial pulse, or his neck pulse? Um, and if so, you can maintain his circulation by resuscitate the patient by CPR, cardiopulmonary resuscitation. You should resuscitate this patient if there are signs of severe bleeding. If you think there are signs of severe bleeding and the casualty's heart has stopped beating, so I think his body needs a pumping machine or a kind of pumping. Okay, so do CPR. How to do it? Try to do the same as this man. Okay, with your both hands, try to press down at the center of his chest. Press down about 5 centimeters 2 times per second, or 120 times per minute. Try to remember these numbers. 2 times per second or 120 times per minute. I think that's all